Let's be real, we've all had a headache. But what happens when that headache just decides to stick around? For millions of people, it's a constant and, frankly, a debilitating presence. So today, we're going to break down the world of chronic headache, what it is, how doctors figure it out, and most importantly, how you can manage it. So where's the line? When does a nagging headache stop being, well, just a headache, and turn into something doctors officially label as chronic? Getting a handle on this one question is really the key to unlocking everything else. And it turns out the clinical answer is surprisingly specific. It all boils down to two numbers: 15 or more days with a headache every single month for more than 3 months in a row. That's the official line in the sand. If you cross it, you're in chronic territory. Okay, so how do doctors actually diagnose this? You know, it's a lot like detective work. And the detective's number one tool isn't some high-tech scanner, it's actually just a conversation. That's right, the most vital clues are hiding in your story. How the pain feels, where it is, what other weird symptoms pop up alongside it. Your personal experience is, without a doubt, the most powerful diagnostic tool there is. And this is kind of the first page of the detective's notebook. They start looking for patterns, like, is the pain pulsating, throbbing on one side of your head, and maybe you feel nauseous? That just screams migraine. Or is it more of a pressing, tightening feeling, like a band around both sides of your head? That's the classic signature of a tension-type headache. Figuring this out is a huge first step in cracking the case. But here's where the plot takes a really surprising twist. What if the very thing you're using to get relief is actually making things worse in the long run? This leads us to a really critical and kind of counterintuitive idea in the world of chronic headache. Welcome to the medication overuse trap. It's a seriously vicious cycle. It starts out innocently enough. You get a headache, you take a pill for it. But pretty soon, the pill wears off, and the pain comes roaring back, sometimes even worse. So what do? You take another pill. And before you know it, the treatment itself is driving this near-daily pain. It turns an occasional problem into a chronic one. And look, this isn't just some vague theory. Doctors have hard and fast numbers for this. If you're using simple over-the-counter pain relievers on 15 or more days a month, that's a huge red flag. And for stronger prescription meds like triptans, the bar is even lower. Just 10 days a month is enough to put you in the danger zone. Now, before a good detective closes the case, they have to do one more crucial thing: rule out anything more sinister. Doctors are trained to look for very specific red flags that might mean the headache isn't the problem itself, but a symptom of something else that needs urgent attention. To make sure they don't miss anything, they use this simple but really powerful tool, the SNOOP mnemonic. Each letter stands for a potential red flag that tells them, hey, we need to investigate this further. Let's run through it real quick. S is for systemic symptoms, like a fever. N is for neurologic signs, things like confusion or weakness. O is for onset, a really sudden, explosive headache, sometimes called a thunderclap headache. The second O is for older age, specifically a brand new headache that starts after you turn 50. And P is for positional, pain that gets way worse when you stand up or lie down. Any of these triggers a much deeper look. Okay, so with all the urgent alerts cleared and that medication overuse trap considered, the detective's final job is to put a specific name to the condition. It's time to officially crack the case. And to do that, doctors make one last vital distinction. Is the headache primary, meaning the headache is the disorder? Or is it secondary, meaning the headache is just a symptom of something else? And that medication overuse headache we talked about, it's actually the most common secondary cause of chronic daily pain out there. And when you look at the usual suspects, this chart shows you the main culprits. As you can see, chronic migraine and medication overuse headache are the big ones. They totally dominate the field, and they often go hand in hand, one fueling the other. After that, you have chronic tension type, and then a few rarer conditions make up the rest. Getting that diagnosis is a massive step, for sure, but it's really only half the battle. Now the goal shifts from investigation to action. It's time to build a solid management plan. You know, there's no single magic pill here. Instead, a really effective plan is built on 4 pillars. First, you've got to break that medication overuse cycle. Second, start a preventative therapy to just bring down the total number of headache days. Third, have a smart plan for those sudden acute attacks. And fourth, bring in lifestyle changes to handle triggers and just build up your resilience. So what does success even look like? Well, for preventive therapy, the goal is crystal clear. Cut the number of headache days by at least 50%. Just imagine that for a second. Having the amount of time you spend in pain, that one change can be absolutely life-altering. This is so important to remember. Living with a chronic headache is not a sign of weakness. It's not a character flaw. It is a legitimate, complex, but treatable neurological condition, just like epilepsy or multiple sclerosis. So I think the final takeaway is really about realistic hope. For most people, a chronic headache is something to be managed, not necessarily cured. The real goal here is to regain control, to lessen the burden of pain, and to shift the balance of power back to you. It's an ongoing journey, and it's one you take with your doctor as a partner. And that brings us to one last, pretty powerful question. This whole process we've just walked through, all the detective work, the pattern spotting, understanding the hidden traps, that's not just for doctors. What if understanding your headache, really getting to know it, isn't just the first step? What if it's the beginning of actually controlling it?